So I've actually just decided to sort of skip this lecture, but because we've run behind on time already, which is a classic when you have a passion for what you're talking about. But I do want to show you just some slides, just so you realize, just a moment, that I get this on in a proper mode. There are actually quite a number of associations around the world, and it's not just the TSCvzw register that is made visible the burden on quality of life of living with TSC. Actually, all these conclusions are all also reflected in Juggling Care and Daily Life, which is the brochure, an outcome of EURORDIS, the European Rare Disease Organization, which they did in a very big survey on all people living with rare diseases, which actually reflects very much what we see in TSC as well. But the reason I'm not skipping my presentation entirely is because I want to pay tribute to what the French organization did in trying to capture how people experience living with TSC in France, and because France is a neighbor country to Belgium, and the TSCvzw register was done in sites in the USA, in Australia, all around. This is more like a European version of it, done by a patient association. So they did a survey in which, I'll go quickly onwards. 319 people responded, representing 412 cases, because some people had several children with TSC and had TSC themselves, so that makes a difference. And what I wanted to point out as well, being a mother, is something Anna touched on as well. It's very, you see that anybody over 15 with TSC could answer themselves if they wanted to. And in the other case, it were the caretakers who responded, and the caregivers responding were 81% of them the women, which does reflect situations in families often enough, I think. And it was also something that was found out in the EURORDIS setting, that juggling care and daily life is something women do seem to have more of an issue with than the men, but maybe I'm being a bit biased here, or maybe it's not fair of me to say this, but yeah, maybe it's at least something to think about. So here is again, you can see how age and severity were represented in the group that was questioned, but we'll go. And these are the things that the questions were about: what manifestation of TSC they were confronted with, how the TSC affected their autonomy, living their lives as autonomous individuals, accessibility to healthcare and education. So most of them had skin problems. I'm going to go very quickly just to the whole. You see on the right side what the answers are in manifestation of disease for the severely affected patients, and on the left side for the not severely affected ones. And you can see that here again, TAND scores very high in manifestation of disease, and also in how difficult it is to manage or not. So the orange is always about if people experience this specific manifestation of the disease as difficult, and the blue is not difficult, which is obviously a very, how do you say, artificial cut, but you have to do these to get some sort of interpretation, obviously. So these are the TSC-associated neuropsychiatric disorders that they asked about specifically. And here, I'm not going to go over them wholly, because we're going to go into what they can all be in further detail in the next lectures. But it does give some idea of what these TAND issues can be. To the degree of autonomy, which I think is very important to quality of life, it's interesting to see that, well, a great number of people, even the ones who are not that severely affected, do, well, not everybody gets round to living their lives autonomously. So of the patients that were represented in the questionnaire, of the over 25-year-olds, 50% were living in a situation of dependence. I'm not going to go into this now because it's been touched on before, and yes, just a small quote maybe here for impact on education. Learning problems often attributed to laziness, but never linked to the disease. This is something that came up yesterday as well, that often people in the educational settings, because they lack knowledge of TSC, they come to the wrong conclusions as to what the reason is for children not performing as maybe they could, in theory, perform. The impact on caregivers. As said before, most of them do experience a significant impact and cut down on the amount they might work. And a lot of caregivers reported anxiety, suffering from anxiety and stress, and this is something that has also been reflected in the Juggling Care and Daily Life research done by Eurotis, is that in people living with a rare disease, whether it be as a patient or as a caregiver, there is a significant increase in number of, well, psychological burden. And the biggest concern for caregivers is what will happen after I'm not there to take care of my child. So there. Then another important issue that is often not addressed as, enough is the fact that the siblings, the sisters and brothers are impacted as well. They are actually also caregivers, and it has a big effect on their quality of life as well. So they came to one conclusion in 4 words. TSC can be described with these 4 words: isolation, complexity, unpredictability, and it's never ending. You never know how strong you are until being strong is the only choice you have. It's something that someone shared on our Facebook group once, and I think it's something that a lot of people, it's a saying that a lot of people come across living with a rare disease. But I do believe that if you're gentle with yourself, because you invariably will crash every now and then, well, you just manage to get through if you treat yourself gently and you have people surrounding you, treating you gently. And crashing, well, we all do every now and then. It's what makes us human. So